Well, Hispanics in the U.S. are also closely watching to see if President Bush will veto the SCHIP bill. We wanted to get more information, so we asked Dr. Jane Delgado to join us from Washington today. Welcome. Thank you for joining us.
Good morning.
Good morning to you. I like that. Very strong and hearty good morning. I have to ask you, why is it so important? Why is the SCHIP so important to the Hispanic community?
It's important to us because we know that our children need good health coverage. But more than us, all children need good health coverage. You know, we were one of the people who supported the expansion of Medicare, where $60 billion a year was added to Medicare so older adults could get their medicines and preventive care. We want something for children, working children, because we know even if you are taking home $3,000 a month, which puts you way above the limits, that in fact you can't afford $1,500 a month for family health insurance.
That's half your, and you're talking about, you know, that's half your income. That's not take home, right? It's more than half to take home. So what are the biggest problems, Dr. Delgado, facing the Hispanic community, and not just individually, but also systemically as well?
Well, the biggest one is that we often do not qualify for public programs because we're working. So having access to health insurance means that many public programs, the income is so low that even though our community is working, they don't qualify because they work. And the catch-22 is they work for employers who don't provide it. And then if you try to get something in the private market, it's way too expensive.
Okay. Misconceptions, because as we're uncovering America here, and we want to, you know, keep people informed here. What are some of the biggest misconceptions about health care in the Hispanic community? Well,
the biggest misconception has to do with our health status. You know, for many years, we've been working on health of all people, understanding what health is from the Hispanic angle. Now, the good news is for us, which was a shock to everyone else, was that in fact, Hispanics, even though we have diabetes, even though we have excess weight, we actually live longer than non-Hispanic whites and have less heart disease.
Okay, that's important. So what can be done, even the problems that we said medically, individually, what can be done systemically, what can be done to help the healthcare in general in the Hispanic community?
You
have some quick tips for us?
Two things. We want healthy children so they become healthy adults. Second, the idea of taxing tobacco, that's something that we've always advocated because we want fewer smokers. This is a good way to make children healthier and make all of us breathe cleaner, healthier air. Those are just some of the things we can do, but there's much more still.
And we can go on all day with this conversation. Dr. Jane Delgado, thank you. Have a good weekend.
Same to you.
Well, Don, you can check out CNN.com's special report on the Hispanic experience today. You can find out more about one of the fastest growing communities in the United States, and it's all part of the Uncovering America initiative, and it's aimed and timed with the celebration of Hispanic Heritage Month.
Okay, this next story just made